life after cancer. It looks different, it feels different, and it takes some time to adjust. But the good news, despite the diagnosis, more people are gaining the title of survivor. The National Cancer Institute says there are over 18.1 million cancer survivors living here in the U.S. They're living life all around you. They're your parents, your friends, your coworkers, your children, your news anchors. Chances of survival only gets better with time. By 2040, nearly 8 million Americans will join the Survivors Club, with more than 26 million Americans living a full life after cancer. I'd like to welcome in Dr. Sheetal Kircher, the Medical Associate Director with the Cancer Survivorship Institute at Northwestern Medicine. I'm sorry, I feel like I'm getting emotional already with this. Thank you so much for your time here. So many people mistakenly think that once a cancer patient is free of cancer, if they're lucky enough for that to happen, that it's all done. But that's so far from the truth. There are still appointments and screenings and anxiety, and just talk more about that.
I agree. It's so far from the truth. It's, the minute that they're done with treatment, whether that be chemotherapy or radiation surgery, I say, okay, I'll see you in 3 months, with that new scan in labs. Well, that although patients are glad to not be coming in every week as they have, that fear of this cancer, they have time to think and really process what has gone on. Yeah. It can be crippling, especially as we have new scans and tests, and it becomes a roller coaster that really doesn't end.
And we know, Dr. Kircher, that medicine continues to advance, and that is helping, more people survive. How has that, though, impacted post-treatment care?
We have more and more survivors, which is awesome. And now as a healthcare system, we need to figure out how do we best care for patients once they're done with active treatment. The Institute of Medicine way back in 2006 talked about lost in transition. And that's that bridge. How do we build that bridge between active cancer treatment and the rest of their life of living well, bring the silos together of primary care and the specialty care. And that's what survivorship care aims to do.
And I think so many times people think of cancer, in sometimes older adults, but it happens so frequently, and it seems like more frequently in young people. This is such a life-altering diagnosis. How do care teams approach the after when we are talking about young people?
Absolutely. I think cancer, no matter what age you are, brings you to the same level of recognizing your mortality and where we are in our lives. But there are unique things for different age groups, things like sexual health. Financial toxicity, which is a word we're hearing more and more, is something that our young adolescent and young adults, they experience at a higher rate than if say we were at the retirement age. So we really need to tailor the needs to where that patient is in their life in order to give them the best care going forward.
And we know that, no one goes through this alone. There are caregivers, family, friends. What is your advice to the family, to the friends of cancer survivors?
It is hard to be a caregiver. I want to just congratulate and clap and give big hugs to everybody that is a caregiver, because it isn't easy. But, you never know what the right things to say. You never know what the right thing is to do, but you just love your loved one. And so ask the patient is what they need at that given moment, and recognize that you may not have always the right things to say. And then going forward, take care of yourself as a caregiver. Eat well, exercise, and take care of your own health so you can be best for your loved one.
Absolutely. Dr. Sheetal Kircher, thank you so much for your time. Appreciate it. And great work is happening at Northwestern, I have to say. All right, thank you. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.